All right, MED200. This is going to review weeks 1 and 2. So respiratory, cardiovascular, and reproductive systems. So you might see some of these questions again. Which of the following is caused by smoking or by exposure to radon, asbestos, industrial carcinogens? So the question gives it away. Carcinogens. Yeah, right. So that one's easy. Just look at the question. Gives the answer away. Not too bad. So there you got the hint. Carcino is the word root for cancer. Medical terminology will help you guys quite a bit. Body cell. So jot these down. You might see them again. Body cells surrounding capillaries usually have a what? So we got blood from arteries to capillaries and then veins. So the tissue, the body cells that surround the capillaries, what are they? Are they high in oxygen? Low in carbon dioxide? High in nutrient? Or low? How many say A? B? C? Wah, wah, wah. If you don't vote, that's how Trump got elected. All right, just kidding. So it's going to be different. So just review that one. It's one of the questions from your cardiovascular. So review week 1. Blood pressure is greatest in the arteries in which of the following condition? Ventricles contract, SA node fires, atrial contracts, or when the heart is between contraction and relaxation. When is blood pressure the highest? SA node fires? So the SA node is in the atrium. Are you saying when the atrial fires? So 2 correct answers or 2 wrong answers? 2 wrong answers, so we can eliminate those. All right. A or D? Between, that's when the pressure is the highest. Pressure is the highest when the ventricles contract. Remember, that's diastole, the top number in your blood pressure, when the ventricles contract. Dun, dun, dun. Pulmonary edema is a condition in which fluid fills spaces within the, what is pulmonary? So is it in the pleura or in the lungs itself? Is it in the cavity? Dun dun dun. It's very specific. So how many say A? Little buddy. B? Got a couple earlier. I didn't persuade you differently. C? Thoracic cavity. Okay, good. We know that one's wrong. Pleura cavity. That's lung cavity too. But when we have fluid, where is this fluid? So edema is fluid retention. So they're referring to the lungs. So very good if you voted for the lungs. Which part of the cardiac conducting system is known as the pacemaker of the heart? There you go. Now it's the SA node. So what rate does the SA node make? About 60 beats per minute with no influence from the brain. So that's the natural pacemaker of the heart. And inflammation of the cartilage attached to the ribs. So inflammation is itis. So all the endings are correct. So very good. Costo is ribs. Chondro is cartilage. So it's inflammation of the ribs and cartilage. This is inflammation of the chest. This is inflammation of the lung cavity. This is inflammation of the chest again. So A, very good. The blank have walls that are 1 cell thick. Which of the following are super thin to allow for very fast exchange, efficient exchange of gas and nutrients? Which part of the cardiovascular system are the leakiest? Is it the arterioles? Nobody? Arteries? Are they leaky? Are the veins leaky? Are the venules leaky? How about the capillaries? Yeah, so remember the capillaries are the exchange vessels. They're super thin so that things can go through them, 1 cell thick. The blank are small vessels that carry oxygenated blood. Small vessels. So arteries are the bigger ones. Arterioles get smaller and smaller. Capillaries are the exchange vessels. What are cilia? A, do they secrete mucus? B, are they tiny structures that trap and hold foreign objects? C, are they composed of macrophages? Macro is big, phage is eating. D, are they flap-like structures that close the larynx? E, none of the above. What is cilia? So cilia is all the little hairs, right? Yeah. So which of the following would describe? C, macrophages? These are big eaters. Are these guys eating? So dun, dun, dun. Is it the flap-like structure? No, that's describing the epiglottis. So we can decrease that, we can decrease that. Dun, dun, dun. Mucus secreting cells in the lower bronchial tree. Dun, dun, dun. So they're the little hair-like structures. So they don't hold them. They sweep them away. The mucus holds on to it. So you got to know everything. So that's the tricky one. If there's ever an E, all the other choices sound kind of similar. Which of these are tiny air sacs surrounded by capillaries where gas exchange occurs? Sacs, the air sacs in the lungs, what are they called? Yeah, that's the alveoli. So this is just multiple, more than one. Bronchioles are the smaller branches in the lungs. Pleura is the cavity where the lungs are. Cilia are those little hairs that sweep the mucus up and out. Which of the following prevents food from entering the airway during swallowing? The glottis? Are you sure? The glottis is the space where the vocal cords slam together. So you want the, what's above the glottis? The epiglottis, right? So we want the epiglottis. Glottis is just the space. The epiglottis is that trap door that folds up and down. It's above the glottis. The amount of air that moves in or out of the lungs during a normal breath. So what goes in and out on the ocean? The tide goes in and out. So which of the following is correct? None of the above. It should be the tidal volume, right? A diaphragm is an example of which form of contraception? So we're not talking about the breathing muscle here. We're talking about contraception. What does the diaphragm do? Is it the rhythm method? Is it a barrier? Oral contraceptive? Is it an intrauterine device or none of the above? None of the above? Everyone agrees? No, we had none of the above for the last few times. Got you in that rhythm, right? So all it does is covers the cervix to prevent sperm from entering the uterus. So it would be a barrier device. A blank period includes weeks 2 through 8 of pregnancy. So, what stage is it in? Embryonic? Blastocyst? Cleavage? I don't even think that's a stage. That's just what the cells do. They split apart. They cleave. Is it a fetus yet? Is it an embryo? Fetus, embryo? What do you guys think? Dun, dun, dun. Embryonic stage. After that, then you get the fetal stage. A mixture of sperm cell and fluid from the seminal vesicle, prostate gland, and bulbourethral gland forms. So everything together is known as formation of sperm. A cell that will eventually become sperm. So we know it's not these. B or D? B. So the other half is D. Nobody for E. So everything mixed together, that's the semen, the ejaculate. So remember, we get 60% from here, 30% from here, 5 from here, and another 5 from the vas deferens. Cystitis in women is likely to result from, so this is infection that causes inflammation of the bladder. So bladder infection. What's the main cause? So that would be, fecal contamination. Tampons, is that supposed to be 2 O's? Tampons cause toxic shock syndrome. So the bacteria that accumulates can form this toxin. Can be deadly. Incontinence, that means you went a little bit. You urinated a little bit. Cramps that are severe enough to limit normal activities are known as, is it inflammation of the cervix? Does it resemble fibers? Is it cancer of the ovaries? Is it cancer of the cervix? Or is it dysmenorrhea, right? So dys stands for difficult, abnormal, or painful. Dysmenorrhea. Prefix. Which of these contain the female erectile tissue and is rich in sensory nerves? Analogous to the male penis. Vestibular gland? The vagina? The infundulum? Where is the infundulum? That's at the end of the fallopian tubes. Can you ladies feel your fallopian tubes? No. Is it the cervix? How many say A? How many say B? D? How many say E? E, because it should be the clitoris, right? So the clitoris is analogous to the male penis. It is erectile tissue, engorges during stimulation. Which of these structures of the female reproductive system produces progesterone and estrogen? Which one? D? E? Uh-oh. Dun, dun, dun. What produces the hormones? It is the ovaries, right? The ovaries make the eggs and the hormones. So remember, when the egg develops, it blisters off and it ruptures. And then the part that remains becomes the corpus luteum if there is fertilization. So the ovary will produce estrogen, and then the corpus luteum, when it's maintained, will produce progesterones. Blank can cause pain during bowel movements. For, I guess, men, which of the following will hurt during defecation? Is it prostate cancer, testicular cancer, prostatitis, or BPH? Yeah, prostate cancer. The other ones, these usually affect urination. All right, not too bad. A few more. So these you'll see again. So you'll get 25 questions for the midterm. You might get some of these as well. Which structure secretes an alkaline fluid rich in sugar and prostaglandin? So they got all four parts here. So this produces 60%, 5%. This produces 30%. This is where sperm is. So we can eliminate that guy. How many say A? B? D? None? All right. So I'll give you a 50-50 then. It's not this one. This one produces the pre-ejaculate, the clear mucus-like secretion. So A or D, which one would you guess? 50-50 now. It tricked you, huh? I went down and then back up. Seminal vesicle. Each lobule of the testes is filled with blank, which are filled with the spermatogenic cells that give rise to sperm cell. So where is sperm produced? Okay, so we know these are wrong. They gave it to you twice. These are cells. Site means cell. So we know it's not the cell, it's where it's being made. And this is another name for the stem cell of sperm. So it is going to be D. Very good. In the seminiferous tubules. Which of the following is caused by a virus and can last 5 to 10 days? Is it COPD, chronic obstructive pulmonary disease, Legionnaire's disease, aka sick building syndrome, pleurisy, where the lung sticks to the lung cavity, or emphysema, the alveolar sacs are damaged, or is it the flu? Which one is it, guys? Yeah, influenza. So if you see influenza, select it. If you don't see it, then select none of the above. So pneumonia, influenza, something like that. Which of the following decreases the heart rate? Which of the following stimulates rest and digest? B or C. So we know that elevated body temperature increases heart rate. So we know that's wrong because your body's trying to get rid of the heat by circulating the blood. Let's see. Low concentrations of potassium. No, that depends, I guess. Inside or outside? So this one's we don't know. So we got flight or flight and rest and digest. Which of the following is flight or flight? Because that's going to be upregulated. Rest and digest is downregulated. So B or C? Which one is going to stimulate rest and digest? So sympathetic is flight or flight. That's going to increase. Because when you feed, run after your food, you got to be stimulated. Parasympathetic decreases heart rate, stimulates rest and digest. The blank valve prevents blood from flowing back into the left ventricle. So what is right before the left ventricle? there. Your cheat sheet right behind you. So very good. So we got the left atrium. It goes through a valve and then the left ventricle. So try to get it right. So this is on the right side. So on the left side is the bicuspid valve. What's another name for the bicuspid valve? So this is wrong. You gave me this. This prevents backflow into the left atrium. We read it wrong. So we want this one, the one before the aorta. Okay, I think that's the one they want. So the blank valve prevents blood from flowing back. Yeah, so yeah, we want this valve here. So before the aorta, we have the semilunar pulmonary. Nope, semilunar aortic semilunar valve. So this one's none of the above. We all got tricked on this one. Dun dun dun. You guys look puzzled. Alright, so we weren't asking for this one. This is what we thought. But what they're asking for is this one, preventing backflow to the left ventricle. So it's going to be the aortic semilunar valve. Alright, I believe the midterm is now open for you guys. So go ahead and log on.